My name is Dr. Nick Armstrong, and I am a general surgeon at St. Luke's Medical Center and the chief of surgery and the section head of complex abdominal wall surgery. I am currently the program director for the nascent Complex Abdominal Wall Surgery Fellowship, which started here at St. Luke's Medical Center in 2025. For those of you who are interested in this field, you'll know it's a growing field. It is a very hot field right now, and very interesting to me as a surgeon who grew up when hernia surgery wasn't cool. It's so nice to see the interest in this sort of fellowship program. I think probably our biggest draw to St. Luke's Medical Center's Complex Abdominal Wall Surgery Fellowship is the fact that there are 3 completely dedicated surgeons in this program. And the 3 of us together, I think, have really created one of the most complicated practices with the highest volume, particularly in robots, that is currently going on in the country. I think for the applicants and folks that come here, they'll know that many of these programs are combined with other minimally invasive projects. And whereas we do have some crossover in our program with some foregut disease, particularly hiatal hernia surgery, the rest of our practice is purely dealing with complicated abdominal wall surgical programs. The complex abdominal wall surgery program here at Advocate Aurora St. Luke's Medical Center, its distinction now is our access to technology. There's a lot of toys that we play with in the world of complex abdominal wall surgery, with the robot being the dominant one, but we have incredible access to it, and accordingly our volume of robotic abdominal wall surgery is very high. Here at our fellowship program, we're hoping to, model ourselves after a standard academic program. And, with the meetings that we have, surgical experience, of course, is key as sort of an apprenticeship sort of model. But also, there are research opportunities here. We certainly have those information. But I think if we were to ask what's our ideal candidate, I think we're looking for someone who's ready to transition from their residency program to clinical practice. We want to have someone come in for a year and not only learn how to operate with some of the most technically demanding surgeries that are out there, but also learn how to code for those surgeries, learn how to see patients in the clinic. One of my soft rules that I've asked my team to think about is we really won't refer anything out unless we simply cannot do it, or of course the patient doesn't want us to do it. I want the surgeons who graduate from our program to be complete, and I want, in my mind, I'm thinking of someone who comes out of this kind of program is maybe going to go to their next place and start their new program. That's the kind of skills we want to equip our fellows with.